Good day everyone, we are here to discuss about a case study of acute stimulant-induced psychosis.
But before we proceed to the main topic, let us first introduce ourselves. I will go first. My name is Dan.
My name is Michelle.
My name is Jeremiah.
And my name is Vance. Dan, can you give us knowledgeable information about the topic?
There is a study about psychosis. It is when people lose some contact with reality. This might involve seeing or hearing things that other people cannot see or hear, or like hallucinations. And believing things that are not actually true is like being delusional. In this case study, they examine why one particular stimulant user experiences stimulant-induced psychosis. They give an account of a patient with an acute psychotic episode admitted to the emergency room at a local hospital.
During initial evaluation, it was discovered that the patient had been diagnosed with attention deficit hyperactive disorder 1 month ago, and that the onset of the symptoms was likely related to an overuse of amphetamines. The patient had no personal history or family history of any psychiatric or mood disorders. He had no history of recreational drug use prior to this incident and no history of seizures and head trauma.
After appropriate pharmacological intervention with antipsychotics and psychological intervention, the patient showed gradual improvement within 5 days hospitalization, and after that 5 days, he was allowed to be discharged. These are the keywords. First is stimulant-induced psychosis. It is a mental disorder characterized by psychotic symptoms such as hallucinations, fired ideation, delusions, disorganized thinking, grossly disorganized behavior, which involves and typically occurs following an overdose or several-day binge psychostimulant. Next is methamphetamines. It is a potent central nervous system stimulant that is mainly used as a recreational drug and less commonly as second-line treatment for attention deficit, hyperactivity disorder, and obesity.
Amphetamines are psychostimulant drugs, which means they speed up the messages traveling between the brain and the body. Caffeine, it is used as cognitive enhancer, increasing alertness and attentional performance, but it can have side effects such as insomnia and nervousness, and is likely unsafe when used in very high doses. It can cause irregular heartbeat and even death. Cocaine is a stimulant drug obtained from the leaves of two coca species native to South America. So cocaine speed up the messages traveling between the brain and the body. So when people take this, they may experience happiness, feeling of alert or energetic, anxiety, and paranoia.
Psychotic disorders are severe mental disorders that cause abnormal thinking and the perceptions of a person. People with psychosis, they lose touch with reality, and the two of the main symptoms are delusions and hallucinations. And then next is schizophrenia. Schizophrenia is a serious mental disorder in which people interpret reality abnormally, and schizophrenia may result in some combination of hallucinations, delusions, and extremely disordered thinking and behavior that impair in daily functioning and can be disabling.
Nicotine is the chemical in tobacco that keeps you smoking. Nicotine reaches the brain within seconds of taking a puff. In the brain, nicotine increases the release of the brain chemicals called neurotransmitters, which help regulate mood and behavior. ADHD, attention deficit hyperactive disorder, is a condition that affects people's behavior. People with ADHD can seem restless and may have troubles concentrating and may act on impulse.
Okay guys, let's talk about the case presentation in a case study of a acute stimulant-induced psychosis. The parents of an 18-year-old Caucasian male bring their son in a psychiatric hospital because their son had become irritable and paranoid. Also, they noticed that their son stopped interacting with them and always wanted to be alone. Aside from that, he doesn't sleep well, he's talking to himself and not attending his school, and he started screaming to his parents. He was given intramuscular lorazepam, with 1 milligram and haloperidol with 5 milligram.
So, what is the purpose of the medicine?
Lorazepam used to relieve anxiety, and haloperidol is used to reduce aggression and a desire to hurt others, and it also used to decrease hallucinations.
He had been diagnosed with attention deficit hyperactive disorder, or also known ADHD, a month ago. At the time of this ADHD diagnosis, he was started on 30 with milligram of lisdexamfetamine, dimesylate, in order to help him focus and become less stressed. Then after 2 weeks, they increased it into 60 milligram, and he started also to take dextroamphetamine sulfate tablets with 10 milligram to improve his concentration and ability to study. Prior to the ADHD diagnosis, the patient had no known psychiatric or substance abuse history. Urine toxicology screen was positive only for amphetamines.
Just so you know that the amphetamines treat ADHD, am I right? Then they can be legal or illegal.
Yes, it is only legal when the doctor prescribed it.
That's right. He had no current history of any serious medical condition, no history of seizures or head trauma, no family history of psychotic or mood disorders, no vegetative depressive symptoms, and no symptoms consistent with mania or hypomania. The patient denied using any illegal drug prior to this incident, and he was not a victim of abuse. The stimulant medications were discontinued by the hospital upon admission to the emergency department. The patient was treated with an atypical antipsychotic, Refe with 1 milligram, and he tolerated that the medications well. He started psychotherapy sessions and released after 5 days.
Now, let's proceed to the discussion of prevalence of stimulant-induced psychosis. It is actually a common mental health condition in today's society. It is psychosis. Up to 3 out of 100 persons will experience this psychotic episode at some point in their lives. And based on research, 74% of patients with first episode psychosis who were hospitalized had previously received a diagnosis for a substance use disorder, according to the study of those individuals. And according to the research also, that 6.3% of patients who were admitted to the emergency room owing the acute medication toxicity developed psychosis. And the median age of the patient who initially presented with psychosis was 29, and for I know that 79.3% of them were men and the rest is women. Cannabis was utilized in 25.9% of reported cases, followed by amphetamines, which is 25%, and cocaine with 16.1%, and 54.3% of the instances more than substance was consumed. And the difference in amphetamine poisoning occurrence between males and females is noticeable. 276 males presented to the emergency department, in contrast only 72 females. This may be due to the fact that males tend to participate in more risky behaviors than females. And one more thing, according to you et al., have found that methamphetamine users may continue to have psychotic symptoms for anywhere between months and years after stopping the drug. And additionally, those who have experienced stimulant-induced psychosis in past or more likely to experience further episodes. And now, Michelle, can you discuss or add more about our topic?
Okay, now let us proceed to the discussion of mechanism of action of stimulants. The majority of stimulants manipulate monoamine transmission. The monoamine consists of dopamine, norepinephrine, and serotonin. So, commonly, stimulants either restrict the reuptake of dopamine and norepinephrine or stimulated reflux, boosting the activity in their pathway. The dopaminergic pathways altered by stimulants are the mesocortical, mesolimbic, and nigrostriatal pathways. So these pathways are known reward and motivational pathways. The mesocortical pathway is associated with cognitive functions such as working memory. It is negative symptoms. The mesolimbic pathway is connected with reward processing, driving emotions into actions, and involved with the development of behavioral patterns. So it is positive symptoms. The nigrostriatal pathway works to produce movements to gain reward and leads to the development of habitual behaviors. So it is movement disorders. And hallucination and delusions have been classified as positive symptoms. So the psychosis may be a result of increased activity of the mesolimbic system. So amphetamine and methamphetamine usage is the most common cause of stimulant-induced psychosis. And the second one is cocaine. So two common stimulants that do not affect the dopamine pathways directly are caffeine and nicotine. So caffeine is the most widely used drug in the world, and nicotine is the active chemical in tobacco products. So it's triggering multiple downstream effects, including the increase of activity in the dopaminergic pathways. So guys, let us talk about the risk factors leading to vulnerability.
An overdose of amphetamines appears to be the underlying issue in our case study that sent the patient to the emergency department. Inquiries and Gershon's and Bell's research shows how amphetamines can cause psychosis in healthy people.
And there have been multiple case studies that show the excessive caffeine consumption during the short period of time causes psychosis, and that the psychosis resolved with the stop of consumption.
So in the case of first episode psychosis, especially in patients with no psychiatric history, the dosage of the stimulant over a short period of time plays a role in causing psychosis. This is most likely the cause of psychosis in our case study.
There have been numerous studies indicating that patients with schizophrenia, schizotypal personality traits, and family history of such disorders are more prone to psychotic episodes with stimulant use.
A phenomenon discovered from animal models which applies to human stimulant-induced psychosis is called sensitization. It occurs with repeated administration of stimulant.
In healthy individuals, stimulant-induced psychosis appears to be the result of taking excessive amount of stimulants. However, this does not explain why some individuals experiencing psychosis at a certain dosage and others do not.
To sum up everything we discussed, let us call Jerimiah to proceed to the last part of our segment, which is conclusion.
Thank you guys for the informative discussion. Overall, the study urged follow-up research and documentation on first episode patients to determine if psychosis happens again or if symptoms worsen into schizophrenia. Understanding the progression of this disease is essential to improve patient care. For now, those who are susceptible to stimulant-induced psychosis due to medical history, a family history of mental illness, genetics, gender, and/or lifestyle must be advised and warned of the signs and symptoms of psychosis. In addition, physicians must be diligent to collect each other patients' unique history before prescribing stimulants to any patient.
Okay guys, let's take this opportunity to thank our viewers and listeners for their time. And we hope that we give them knowledgeable information about our segment.
Yes. Thank you guys.
Thank you guys.
Bye-bye.